But in my role as a program manager, I coordinate like community events as well. And we're doing our first ever Food Allergy Awareness Week event on Saturday. And I'm in charge of that as well. So I've been like trying to figure out all the things for how to plan stuff. So anywho, so yes, as Olga mentioned, I sort of came to allergy nursing by accident, I guess. I was working in the ER at Children's and was tired of that and saw a job listing for a research nurse. I didn't even know what specialty it was in. I just was like, oh, that sounds nice. And I applied for it, and here we are. That was 5 years ago. So yeah, so I'll go ahead and feel free, if you have questions, comments, whatever, feel free to just like jump in and ask me. That's fine. It's really not super formal. So I just was going to provide a little bit more context about our program overall and then the OUtMATCH study. I did want to do like some informal polling to see like what you all already know about the study and Xolair and stuff, just so that I'm not telling you stuff that you already know. I'll talk a little bit about the study overall and then like my experience as the sort of primary nurse coordinator for the study at our site. I'll just highlight a couple of the publications that are out there if you want to look them up. I'm not going to go into too much detail on 2 of them, and then talk about the big one that was published in February for the results, essentially, of the Xolair portion. But I'm most excited, and I'm going to try to go through the other stuff really quickly so that we have time for discussion at the end, because I want to hear what you all think. We're trying to figure it out in Atlanta, but I'm curious what other people are doing and how they're sort of handling this new indication. So that picture is from Quad AI, and that's me, and then the other coordinator from our site that worked on the study. And the 2 of us were hired specifically to work on OUtMATCH. We're both brand new to allergy and have trauma bonded for sure, and enjoy working together. So we both were able to go to the conference where the paper was presented, and it was very exciting to see those signs everywhere. So just for some context for anyone that's not familiar with OUtMATCH or with COFAR, COFAR is a NIH consortium made up of 7 research sites. We are not a COFAR member. We were invited as a guest site. So the other, I'm going to say it wrong. So 2 of the other sites were also guest sites to make up 10 sites that participated in this study. This picture is some of the other coordinators and staff from the other sites that worked on the study who were also at the presentation at Quad AI. So you may recognize some celebrities like Kim Mudd and Lauren Herlihy, Jamie Ross that were there. So that's sort of who we were able to wrangle. But I've talked to most of these people on the phone weekly for the past 5 years, and this was the first time I met most of them in person. So that was fun to meet them. This slide is really about sort of our site. So the food allergy program as a research program specifically at Children's Healthcare of Atlanta and Emory University was really started 5 years ago. And that's part of what our celebration on Saturday is about, is it's our sort of 5-year anniversary. So compared to some of these food allergy powerhouses like Stanford, Mount Sinai, Johns Hopkins, we're like little babies in food allergy research. And we're new and kind of building everything from scratch. So the person that Children's hired to start the food allergy program is Dr. Brian Vickery. So this guy, if you read about food allergy research news, you will know him as the peanut OIT guy. who went to work for Aimmune and got Palforzia approved by the FDA. This picture is from the very first dose of Palforzia given outside of the research context. It was given on March 13th, 2020. So no one heard about it. But it was very exciting for us. And then, you know, our worlds all changed. But that was sort of Dr. Vickery's like claim to fame, and probably one of the main reasons, you know, why he got invited to participate in OUtMATCH at a center that did not previously have a food allergy program. So you can tell, you know, others in the food allergy world think very highly of him, that they were willing to invite him to participate in this study based on his reputation alone, really. So this was a picture from our site initiation visit that was in September of 2019. That was like my second week in my research role and food allergy role. So I had no idea what they were talking about for most of that presentation. And then I just wanted to highlight, these are some of our other team members. So Dr. Trisha Lee is one of the sub-investigators. Dr. Mira Patrawala was a fellow who then sort of got caught in the COVID job disappearance and ended up doing a lot of our food challenges for us before she went to work in private practice. And then this is Idil Ezuthachen, who is an allergist that sort of joined us towards the end of the study. And this is a picture from when we were able to go to the NIH back in November to sort of talk about the study results. So that was very exciting. So we made it from 2019 to 2023. And this is the building where we do all of our research studies. So our research unit, we have an outpatient research unit that is in the same area as the allergy clinic. So it's a separate area, but we're on the same floor of this very nice new building that coincidentally also opened about 6 years ago. So there's a hospital that you can't see, but to the right of that building that is opening in September of this year. So this was sort of the first building on the new children's medical campus in Atlanta. So that is exciting. Big picture, the allergy clinic overall, prior to 2019, the only two people that are still there that were there before Dr. Vickery were Dr. Jerry Lee and Lisa Kobrinsky. Dr. Kobrinsky is essentially retired now, and then everybody else is new. So including two nurse practitioners that started about the same time I did back in 2019. And they both see mostly food allergy patients. They do lots of food challenges, lots of OIT now, and a lot of the food allergy patient management. So they're great. And Chelsea and I actually worked in the ER together before we found our way to allergy land. I did want to highlight, this is one of many, many private practices in Atlanta, but because we are a really small allergy practice, trying to recruit patients for our clinical trials, particularly OUtMATCH, would have been impossible without the partnership of a lot of the private practices. So I just highlighted Atlanta Allergy because they're one of the biggest. You can see they have 19 locations around the metro Atlanta area. We have one location. So they obviously see way more patients than we do, and they do see pediatric patients. So they referred a lot of the patients that we ended up screening for OUtMATCH, and are very friendly. So we work closely with them. Okay, so let's see. So I heard a little bit sort of about people's backgrounds as we were chatting at the beginning, but is anyone not at all familiar with OUtMATCH or the study that got Xolair approved by the FDA for food allergy? Thumbs up, familiar, thumbs down, not familiar, we'll say. Okay, it looks like most people are pretty familiar with it. I think I'm trying to see everybody here. Okay, so I won't go into like excruciating detail about that. And then was anyone using food allergy in their or using Xolair to treat food allergies prior to this year?
We were, but like
You were not officially.
yeah, exactly.
Yeah.
Oh,
We
Mary, I
had
just want to
one patient.
say, Ali's at Mount Sinai and Sarah's at Stanford Children, just so
Okay.
you know. Okay.
So y'all know. Okay. Has anyone been involved in the prescribing of Xolair for food allergies since February? Okay. And then just so that I know how familiar people are just sort of with clinical trials on the, sort of other side, does anyone else do clinical trials, or is mostly like, okay, Kathleen, okay, and Allie. Yeah, okay. All right, great. So I just wanted to sort of get a sense of who was here and what abbreviations I could fly through and stuff. So perfect. All right. So this is the article that it sounds like pretty much everyone is somewhat familiar with. So we were one of the 10 sites, as I said, that participated. Prior to the New England Journal article getting published, they did publish the protocol design and synopsis back in 2022. So if you really want to read more about it, you can look it up. But this is that. So, what I'm sharing, as I say, is all like publicly available. This is an image that is from that paper. It is also in the consent for the document, or the consent for the study. So I spent a lot of time trying to explain this to people over the phone, which, as I'm sure you can imagine, is not super easy. I would usually email it to them, and then I would say, can you open the attachment I sent you and turn to page 5, and I'm going to review this with you, before they come in to even actually consent for the study, just so that they have an understanding of sort of what they're signing up for. So I put down here at the bottom sort of where we are today. So we have closed to enrollment. We're not doing any more screenings. Stage 1 has closed. That's the results that we'll be discussing. Stage 1 open label extension is also closed. Stage 2, there are, I would say, a handful of patients across the 10 sites that are finishing stage 2 currently. And then stage 3 is mostly done, but there's definitely some lingerers. And then the people that are finishing stage 2 will have the option to continue on to stage 3. So it's a pretty complicated study. As I say, I'm mostly just going to talk about sort of stage 1 because that's the results that are available. But, even when people were signing up to participate in the study, we couldn't tell them for sure whether they were going to be in this open label extension group or they were going to be in this OIT versus Xolair monotherapy group that lasts like 3 times as long. So there was a lot of discussion with families, a lot of people declining to participate. And it was very interesting to try to explain this as someone who knew nothing about food allergy when I first started. So that was exciting. But I know a lot more now. So this is from the article, just sort of a little bit of background. So 435 people, children and adolescents consented to screen for the study. And 177 of those were randomized. So you can see that was a pretty big screen failure rate. You could screen fail sort of at any point during the screening period. So some people screen failed because their skin prick test or IgE levels were not qualifying. But a lot of people did screen fail during this food challenge portion because we did 4 double-blind placebo-controlled food challenges, and you had to react to the 3 that were food, allergies, and then not react to the placebo one. So, I mean, these are all-day procedures. They take longer than normal sort of clinic food challenges because there's more doses, and they're obviously high-risk procedures that people are very reluctant to participate in. So it was really challenging to even get people through screening, and then that was sort of just the beginning. So I put these 2 graphics, when I was thinking about like how to describe the screening process. You were really looking for a needle in a haystack, and then like once you convinced them to come in, you were trying to like Goldilocks. They couldn't be too allergic, and they couldn't not be allergic enough. And there were a lot of people that screen failed, and there were way more than the 435 who we pre-screened. Like I can just say for our site, I think we pre-screened between 300 and 400 people, and then actually consented 50. So it was a lot of combing through charts, a lot of phone calls, a lot of trying to get lab results, stuff like that. This is the inclusion exclusion criteria. I just took it off of clinicaltrials.gov. But essentially you had to be allergic to peanut and at least 2 other foods, either milk, egg, wheat, cashew, hazelnut, or walnut. And they defined allergic as having a positive skin prick test greater than 4 millimeters. And for some of the foods, positive food-specific IgE, they did accept skin prick test only for the tree nuts. That was a protocol amendment shortly into the study. And then you had to do the food challenges and react to less than 100 milligrams of peanut or less than 300 milligrams of the other foods. And you had to be at least 10 kilograms, which did actually get us with one patient. We had to wait because he was too small. So I'm going to sort of work backwards to stage 1. So stage 3 that I mentioned is sort of this like real world dietary consumption that you sort of transition people to. These real world food equivalent sheets have been published, and here's the citation for it. I just put an example of the first page of the peanut one because I had it handy. But it essentially goes through different levels of the amount of allergen protein, and then how much of a real world food equivalent has that amount of protein in it. And that's sort of how we do the dietary consumption portion of stage 3. So if you're interested in these, they're available for all of the study foods at many different dose levels. I think it goes up to 6 grams, maybe 4 grams, somewhere around there. So they're pretty handy. And if you're interested, you can find them there. Stage 2, as I said, ongoing. I just put these like funny pictures that I had. OIT, so this was at Christmas last year. Our wonderful pharmacist who has spent years of her life ordering OIT and keeping up with various kits did an elf on the shelf eating OIT, so that was funny. And then these were the nurse practitioners made these decorations for our providers' doors that I thought were funny. So the last patient, last visit will probably be towards the end of the summer, and then eventually that data will be published as well, comparing Omalizumab monotherapy with OIT facilitated by Xolair. Okay, so these are all just images from the New England Journal article. So you can see the number of participants with each of these allergies. The primary endpoint was peanut, and it's just showing the difference between the Omalizumab monotherapy group and the placebo group after about 4 to 6 months of treatment. So you can see it's pretty dramatic. This is the number of people who met the pre-specified threshold. So 600 milligrams for cashew, egg, milk, walnut, hazelnut. Oh, sorry, 600 milligrams for peanut, 1,000 for all of those foods. So this is the number of participants who were able to consume that amount without any symptoms or dose limiting symptoms. The distribution here you can see was, how many of the 100 and everyone was peanut allergic, so 177. And then you can kind of see where other people's allergies were. Some of the participants were allergic to more than just the foods that we did the food challenges for. So for example, we have a patient that is walnut, cashew, and egg allergic. And so they just had to pick what 2 foods they wanted to use out of those 3. So we don't do food challenges or anything to their non-study foods. So that's that. This is, I can't remember the name of the fancy graph type, but anyway, it shows at each dose level during the food challenges, how many participants, or what, I guess is what percentage of participants from each group were still tolerating their doses. Survival curve, I think that's what this is called. So you can see here's the one for peanut, and then here is the ones for the other foods. I don't know. Oh, nobody in the egg group, I guess, got to 600. So that was what that would be. So, the data is not as clear kind of for the foods with the smaller sample size, but I think that's probably to be expected. And then, yeah, so that's, I didn't really want to like dig into the numbers super closely. But spoiler, the FDA approved it based on this data. This is the indication. So obviously we didn't test it to every single food. We tested it to 7 foods. And participants in the study were started down to 1 year. So that was not super surprising. We didn't actually have very many adults in the study. So the fact that they didn't cap the age was interesting. The FDA indication does state that you're supposed to continue avoiding the food. So it's just supposed to help with accidental exposure. This is a little graph that Dr. Vickery put together for a recent internal meeting, but we have a group that has been working on implementing Xolair for clinical use and sort of how do we manage that. And so we've been tracking the number of people that have inquired about it. We have one nurse on the allergy clinic team who is sort of fielding all of the inquiries and sort of getting people started with lab work or whatever they need to do to determine if they would be eligible for it. And then you can see this is how many people the provider needs to do some level of discussion with, and then this is how many people we actually have dosing. So we now have 5 patients from our clinic who are actually on their Xolair injections. This is a little bit old, but yeah, so that's where we are in terms of our clinic. We've had lots and lots of discussions about it, and know that we're going to get all sorts of questions about, can I do OIT with it? And can I eat the food? Can I do a food challenge? All sorts of stuff. And we're, actively trying to sort of answer those questions for ourselves. And I know Dr. Vickery is involved with lots of other, investigators from this study and from other sites, in trying to offer guidance based on their experience in the study to other providers about how Xolair, can and perhaps should be used for the management of food allergies based on the data that is currently available. But it's a brave new world to try to figure it out. So that's
Mary, can I
really
ask
all
you-
I have.